supply was most contaminated with HIV, the virus that causes AIDS, the 2 years that my stepdad was injecting himself with this medication. So he unknowingly contracted it, and he unknowingly passed it on to my mom. I nursed 2 people who I loved dearly to their deaths. And I watched what this disease did to them, as it made them feel like lepers, as I watched them lose their independence, their dignity, and their life. And I will do whatever I can to prevent you guys from getting this disease. Do you know that 50% of all new HIV infections in the United States are occurring in the 15 to 24-year-old age group? That's you guys. And we're seeing about 56,000 new infections in the United States. How many of you believe that HIV and AIDS could personally touch your life at some point? Raise your hands. All right, this is what's scaring me. Look around and look how many hands just went up. Probably about 6 people. And I know so many people are infected with this disease. So for all those who don't raise their hands, you may think that it may not happen to you, but it can. Because here's the scary thing about this disease. Do you know what the incubation period means when we talk about a virus? Does anybody know what it means? From the time that a virus enters your body until you see the first symptoms. Common cold enters your body, you incubate it for 2 days before you get sick. Does anybody know what the incubation period is for HIV to AIDS? If you don't, nope, if you don't get tested and you don't know you have it, how long does it take to show the symptoms? 10 years. 10 years. Virologists call this the ultimate virus because the goal of a virus is to be able to want to pass itself from one person to another. So for 10 years, you look good, you feel good. You have no idea you have it. And because of that, you're lending yourself many opportunities to pass this on from one person to another. So the bottom line, you can't judge a book by its cover. People with AIDS look healthy for a really long time. What are the 4 bodily fluids that will pass HIV and AIDS on from one person to another? Yell it out. Take a guess. Blood. Good. What else? Semen. Right. Vaginal secretion, breast milk, she got the tough ones. Those are the only 4 fluids that will infect a person. Blood, semen, vaginal secretions, and breast milk. What do you think is the highest risk sexual activity in terms of passing HIV and AIDS on from one person to another? Anal intercourse. Guys, I want you to think about this. All right, no, I don't want to think about it, he's going. I want you to think about your body parts and what they were built to do and what they weren't built to do. The anus was built to be an exit ramp. It wasn't built to be an entrance ramp. If you... Thank you. If you look at the rectal wall under a microscope, which I'm sure you all can't wait to go out and do tonight when you leave here, it has only 1 protective cell layer along it. Compared to the vagina, the vaginal wall is 40 cell layers thick. So the rectal wall is very thin. So whenever you engage in that activity, you have tearing of the tissue. And now if you have HIV-infected semen coming in, it's going to enter right into the bloodstream, okay? So, and I see a lot of young women that are engaging in this. In fact, I had a girl at a campus in Maryland who came up to me after the program, and she revealed to me that she was HIV positive. I hugged her. We talked for a long time, and then I said, "Do you even know where you got it from?" And she said, "Yes. My ex-boyfriend and I engaged in a lot of anal intercourse, and we had no idea that he was infected with HIV." So if you choose to engage in this activity, you should use plenty of lubrication to prevent tearing of tissue, and you should always have a condom on in place, okay? You can get HIV from oral sex, and who do you think is most vulnerable to contracting HIV from vaginal intercourse, males or females? Females, ladies, we have 3 strikes against us. 1, there's a higher concentration of HIV in the semen than there is in the vaginal secretions. 2, women get what they call micro-tearing, microscopic tears along the vaginal wall from the friction during the intercourse. So you have that little tear. Again, we're on microscopic levels. That little cell can enter the body that way. And 3, women retain semen or in contact with semen longer than guys are in contact with the vaginal secretions.